So this is going to be very, very important for local, because this is too far covered, too far to do for these kind of procedures. Get to Dr. Redfield. So where are you going? I'm in Montego
Yes, I know. I saw you. Were you in the media today? I saw you doing something today.
I've been here since Tuesday.
Yeah. You're very busy.
Yeah. I bet you next time.
I think I know these ladies.
See any other elected representatives, but if they are here, I recognize them. I recognize the health fraternity, clearly Dr. Rachel, but also my lady in green over there. Best color right now, these times. Ambassador, good to see you, sir, and members of the Hospiten team. I want to just recognize them also, all of you, both who work here or who coordinate the activities here, including, of course, your primary leader. Distinguished ladies and gentlemen, it's my honor and privilege to be a part of this because we embrace the concept of partnership. I begin by saying what the practical challenges are and why this is important. And I know Minister Bartlett will elaborate when he speaks. If you are to add the number of tourists that pass through these parts between Hannibal and Trelawney, I'm told somewhere in the region of 3 million or so, Mr. Bartlett can correct me, between stopovers and visitors on cruise ships. And the local population of about 500,000 between the three parishes. You appreciate, not to mention the transient passers through like myself, you will appreciate the population, and if you were to combine that with the clinical evidence of cardiovascular issues, it is invariable that you're going to have a need for emergencies that will require standardizing response to save lives as it relates to cardiovascular disease. So the demand is there, and as undesirable as it is a reality that we must face. Now, I add further the other very important data that the government has responded or is attempting to respond in the best way possible to dealing with some of these issues against all the challenges that we face. The expansion of the health budget to address the sick profile of our population has more than doubled over the administration, from 60 billion to 140 billion Jamaican dollars since 2016. And in this parish, where a lot of the concentration of specialized care is located, the Cornwall Regional and Western Child and Adolescent to come, we are building out a state-of-the-art facility that will see the highest concentration of hospital beds, not just in Jamaica, but in the Caribbean, almost 800 beds, with 12 brand new operating theaters and a range of services, including specialized services. Having said all of that, the importance of having options, and indeed in keeping with the principle of universal access to health, where those who cannot afford must still access, but those who can should have an option as to where they access and how they access, is something that we embrace, and we believe that health should be one health as we embrace the technology that makes a patient, one health record that we are implementing also. So it is in that context that I commend the Hospiten group for the expansion that they are now undertaking and launching. There's a lot of capital investment in that, and I think it will add a lot of value to the many people, local and overseas, who pass through these parts, to give a sense of confidence that if they need it, the service is available. And for that, we think it will augur well for the growth and expansion, both of the local industry as well as the industries that target our visiting friends. Just to finalize by saying that we want to challenge all concerned to make this partnership as meaningful as it is relevant to the profile of our population, and to adjust where necessary, and I know you have the capacity so to do and have been willing so to do, based on the circumstances within the environment. I heard the statements around the insurance companies, and I would make a call for local insurance companies to see the health profile, see the options that are available, recognize the costs that are involved, both for the investment and for the services, and where necessary, adjust likewise so that it becomes meaningful or even more meaningful to those who need the service. There's another gap that we have to confront, which I think the partnership should involve, and that is the gap of human capacity, training of people. I do note that those technicians, clinicians who are involved in this project, and we celebrate them, are also involved in the public space, meaning working in the public health system. And invariably, that's how it works. And it is a good thing that we allow in our system, both the public system and the private system, to share in the human resource capacity that is available. It's important, it's necessary, and it's the only way to create a combined approach to serving the population. But even with that flexibility, the truth is we do not have enough, and we need more. And so if I were to challenge Hospiten on their own grounds in a friendly way, I would say to them, let this facility with the technology that is available be available also for clinical rotation possibilities, so that the doctors that you need, that we need, that the patients need, that your market needs, at some point can rotate around some of the equipment that you have, some of the facilities that you have, as they do around the ones that we have, so we can put more people in the system at all levels to ensure that the quality of the service is maintained and we are not tripping over ourselves because we have the machines but don't have the people to man the machines. It is a real dilemma. It is the bottleneck to service provisions, and to the extent that we are internationally linked and networked, we probably have a better solution together than separate. And that will be my charge as I celebrate this achievement with you. So thank you very much. We embrace and endorse the partnership, and we say let us work together to make it as meaningful as possible as it relates to the services for all the people all the time. Thank you.